Hi, you guys. Welcome back for our daily practice questions. It is day 92, and as always, I like to first start with my introduction and disclaimer. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And if you are looking to grab this last spot for our upcoming FMP and AGMP 5-week review, class starts April 21st. Click the link in the description to join. All right, y'all. Question number one states a 45-year-old female presents to your clinic with complaints of numbness and tingling in her right hand, especially in the thumb, index, and middle fingers. She reports that the symptoms worsen at night, often waking her up from sleep. She also mentions that she has been working long hours typing at her computer. Upon exam, you note some weakness in her thumb muscles. Which of the following is the most likely diagnosis based on her presentation? Is it A, cervical radiculopathy, B, carpal tunnel syndrome, C, rheumatoid arthritis, or D, de Quervain's tenosynovitis? Take a moment and tell me what you got in the comments, y'all. Tell me your thoughts. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which of the following is the most likely diagnosis based on her presentation? And what do I always say? If they're looking for a diagnosis, you need to run it back and look at those assessment findings. Ask yourself, what are their signs and symptoms? How are they presenting? What is the chief complaint? And then also, I always tell y'all to pay attention to these three areas if they are provided: their age, their gender, and their ethnicity, right? So here we have a 45-year-old female who comes into the clinic complaining of numbness and tingling in her right hand. That is especially noted in the thumb, index, and middle fingers, right? She reports that the symptoms worsen at night so much that it's waking her up from her sleep, and she types a lot for long period of times, right, on the computer. On exam, there is noted weakness in her thumb muscles. Based on this presentation, what are we thinking, y'all? So, y'all, when you think about carpal tunnel, especially when they're talking about the thumb, index, and middle fingers, those first three fingers are often the affected fingers because the median nerve is what is affected when we're talking about carpal tunnel, okay? So, know the key identifiers, all right? So, B is your best answer. All right, question number two. A 50-year-old male presents with persistent numbness and tingling in his right hand, particularly in the thumb and index fingers. During your physical exam, you tap lightly over the patient's median nerve at the wrist. The patient reports a sharp tingling sensation that radiates into the fingers. What is the test known as, and what does this result indicate? All right, so is it A, Phelan sign, B, Tennell sign, C, Finkelstein test, or D, the Allen's test? Take a moment and tell me what you got. And when you tell me which one, the second part of my question, I want you to answer in the comment. What does that positive result indicate? Okay. All right. So, stem of the question: what is the test known as, and what does a positive test result indicate? So, first, which answer choice describes the test that they're describing in this question? So, here we talk about a 50-year-old male that comes in with persistent numbness and tingling in his right hand. You tap lightly over the patient's median nerve at the wrist, and the patient reports a sharp tingling sensation that radiates into the fingers. What test is that? It's B, Tennell sign. Okay, and what does a positive Tennell sign tell us? A positive Tennell sign indicates carpal tunnel, right? Remember, they're talking about this thumb, an index finger, The median nerve is where we're tapping because we're assessing if the median nerve is affected, which I told you in question one is associated with carpal tunnel, right? Remember with Tinel sign, I always say think T for Tinel, T for tapping. That is the one we tap on the median nerve um, to see if there's any pain elicited when we tap. Okay, so B is your best answer. And lastly, question number three, a 60-year-old female with a history of wrist pain and numbness in the hands comes to your clinic. During the physical exam, you ask her to flex her wrist maximally and hold the position for about 60 seconds. The patient complains of increased tingling in her thumb, index finger, and middle fingers after holding for this position for about 30 seconds. So, what does this sign suggest? Is it A, a positive Phelan sign, likely indicating carpal tunnel? B, a negative Phelan sign, indicating a possible neck problem? C, a positive Finkelstein test, likely indicating the Quervaye's tendinosynovitis? Or D, a negative Tinel sign, unlikely to have carpal tunnel syndrome? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, what does this sign suggest? So, okay, clearly we need to figure out what sign we're talking about and then identify what it suggests, right? So this patient is a 60-year-old female, has wrist pain and numbness in the hands, comes into the clinic. And on exam, you're asking her to flex her wrist maximally and hold that position for 60 seconds. She's complaining of increased tingling in her thumb, index finger, and middle fingers, right? Again, making you think carpal tunnel, right? And it is positive because when she's holding this position, she is having pain, right? And numbness, right? And tingling, right? All positive indicators. So your best answer is a positive Phelan sign, likely indicating carpal tunnel syndrome, right? So remember, the two tests that we commonly do to diagnose or to aid in the differential diagnoses of carpal tunnel syndrome is your Phelan sign and your Tinel sign. Remember, Brittany's Brilliance, T for Tinel, T for tap, because we tap on the median nerve to see if there's any pain elicited or numbness while doing so. That will be a positive Tinel sign. Phelan sign is like the backwards prayer hand. So when we're flexing these wrists maximally, you're holding them together on the back of your hands. And then if there is any pain, numbness, or tingling, especially like to that thumb, index, and middle fingers, that's also a positive Phelan sign. Okay. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, custom packages or plans, or question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.